Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is 26 July 2025. This video is on two articles, both open access. First is sex-specific coronary artery calcium percentiles across South Asian adults. Combined analysis from the MASALA and DILWALE studies published in JACC Advances. And the second is an expert analysis on the same topic published at ACC.org on July 22nd, 2025. South Asians in the US have a higher risk of atherosclerotic cardiovascular disease, not fully captured by traditional risk models. Coronary artery calcium is a strong predictor of atherosclerotic cardiovascular disease risk, yet sex-specific reference values for South Asians in the US were lacking. So these investigators combined data from the MASALA, a community-based cohort of 1,119 individuals, and the DILWALE, a clinic-based cohort of 1,624 individuals, a total of 2,743 adults, ages 33 to 75. 37.8% were women. Coronary artery calcium was quantified using cardiac-gated CT scans, non-parametric smoothing used to model sex-specific coronary artery calcium percentiles by age, prevalence of traditional risk factors. 38.5% had hypertension, 46.2% had hyperlipidemia, 17.8% were diabetic, and 3.8% smoking. The mean age of the cohort was 52 plus minus 9 years. South Asian men in the US are those with coronary artery calcium score greater than 0 seen in 65% by the age of 55, and in women 30% by the age of 55, and greater than 50% in those between 60 to 65. Early onset and higher burden in men. At age 60, 75th percentile of the coronary artery calcium scores were found in 186 men versus 26 women. The 90th percentile scores was found in 580 men versus 115 women. Coronary artery calcium scores greater than 0 occurs 10 to 15 years earlier in men. A coronary artery calcium score of 100 is about 75th percentile in men aged below 55 and women aged below 65. What are the limitations of the study? Underrepresentation of women in DILWALE, lack of ancestry disaggregation, missing data, differing enrollment periods, no outcomes data. Key takeaways: South Asian ancestry is a risk-enhancing factor per ACC/AHA guidelines. Coronary artery calcium scoring offers more precise risk stratification than traditional tools in South Asians in the US. Personalized coronary artery calcium percentiles support targeted prevention, earlier screening for men, strategic screening for women above the age of 55. This study provides a foundation for future outcome-driven risk prediction in the South Asia US population. The accompanying expert analysis at ACC.org says South Asian adults in the US have earlier and higher coronary artery calcium burden than most ethnic groups. Pooled studies of 2,743 adults, 37.8% women, mean age 52 plus or minus 9 years. 41% had coronary artery calcium score greater than 0. By age 55, 65% of the men and 35% of the women had coronary artery calcium greater than 0. Women show a sharp rise after menopause. Sex-specific coronary artery calcium score percentiles provide better risk quantification than traditional models like pool cohort equation, or Q-risk. Men may benefit from coronary artery calcium screening before age 50, women after age 55, especially with risk factors. Study is limited by underrepresentation of women, no long-term outcome data, and lack of ethnic subgroup detail. This commentary emphasizes personalized prevention guided by coronary artery calcium scores as being critical for precision cardiology in South Asians. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.